Hi, John. My name's Kaylee. I'll be your student nurse today. Can you verify your name and date of birth for me, please? He says his name and date of birth, John Doe 4/11/67, and it matches. And I see that he has no allergies. So John, I know that you spoke with your doctor earlier today about a blood transfusion, and we are going to go ahead and do that. I know he spoke with you, and you signed this consent form, so we're going to get that started, okay? Do you understand? Okay, good. Now before the blood comes from upstairs, while we wait for that, I'm just going to get everything ready. And I'm going to make sure that your IV site is good. All right, so I'm looking at the IV site, and I see here that they're using an 18 gauge catheter, which is appropriate for giving blood. Going to clean this. That actually is filled. All right, and your IV looks good. So John, it's really important while you're getting the blood that you tell me if you experience any symptoms such as shortness of breath, chest pain, back pain, or a possible fever, because you could be having what we call a transfusion reaction. So I'll be with you for the first 15 minutes to monitor for that, but it's really important that you tell me if you start experiencing any unusual symptoms, okay? Do you understand? And yes, he understands. So I'm going to continue prepping. I'm going to set up my tubing. Okay, and I have some normal saline here. Looking at the bag looks good. It's no leaks. It's clear. Also, the expiration date is appropriate. And then I also have my tubing, and that expiration date looks good as well. I'm going to unravel my tubing. I'm going to close my clamp. Close this one as well, just for now. I'm going to fill this chamber up with saline all the way past the white filter because I don't want the blood cells falling on that filter without saline. And there we go. It's above that filter line. I'm going to prime my tubing here. And that looks good. clean up. And it looks like my blood is here. So Jeremy, you want to be my blood nurse with me, please? And here's a pair of gloves for you. You're welcome. So first thing that I'm going to look at is my patient's red armband, and I have a red armband number of 456654.
It is 456654.
Okay, perfect. Medical record number 224466.
Medical record 224466.
Account number 123456.
Account 123456.
Patient is blood type B positive.
B positive.
Donor blood type is O positive.
I have O positive.
And that is compatible. And then
Okay.
expiration date 12/22/20, 2000.
It is 12/22/2020, and compatibility test completed.
Okay, perfect. And then, okay, so now I don't want to have this blood not be in use. Well, it can't be at room temperature for more than 30 minutes, so I'm going to get it hung right away. I'm looking at the blood, making sure that it looks how it should. No unusual color. I'm also inverting the bag to help mix it. And then I'm going to close this line. Grab this one. And this one. Good. Make sure this clamp is closed. And it is. Go ahead and hang this. That one is closed. That one is open. So now what I'm going to do is I'm going to prep the line with blood. Making sure that I don't and right there before it hits the end. Looks good. Lock that on. I'd also check my facility policy that would relate to using a blood warmer or a possible filter. I'm going to select blood RBCs because that's what we're giving today. Yes, that's correct. Because I'm going to be with him for the first 15 minutes, I'm going to set it at a rate of 50 and a volume of 200. And I'm going to open up this clamp. That's closed. I'm gonna go ahead and hit start. I'd watch for my appropriate drips. I have 50, and scrolling is blood RBCs. So that looks good. I would continue to take vitals per my facility protocol every 15 minutes and 30 minutes and monitoring the patient for a possible reaction. And then I would put it to a normal rate after 15 minutes. And that's it.